So for the next bone which we'll be looking at is a very complex bone. Um, it's a very complex bone of the upper limb. Right? So this is known as a scapula. Right? So we get to look at the anatomy of the scapular bone. Okay? So this is basically the scapula. The scapula is really like a blade, okay? Just like a knife where you use this side like this to actually cut something. So look at everything that has to do with the scapula, okay? So we said that the scapula, also known as a shoulder blade, is a flat triangular bone which is located at the back of the rib cage, okay? So you are like this, you are at the front, the scapula is actually at the back, all right? So it plays a crucial role in shoulder function and serves as an attachment for several muscles. Okay, several muscles on the scapula. So for the different parts of scapula, we have the spine of the scapula. This one is a prominent ridge running along the posterior surface. Okay, so this is a spine. All right, that's the posterior surface of the scapula. Then it divides the back of the scapula into what? The upside, which is known as what? Supraspinatus or supraspinous, sorry, supraspinous fossa. And the down one is what? Infraspinous fossa. Okay. Then acromion is the extension of the spine. It forms the highest point of the shoulder and articulates with the clavicle. That's this is acromion, right? Acromion. Now, for the coracoid process, this is a coracoid process in the front here. Okay. So coracoid process is a hook-like structure on the anterior surface, and it provides attachment for the biceps brachii muscle. For glenal cavity, it's a shallow socket that articulates to the head of the humerus just to form the shoulder joint. Okay. Now, supraspinous fossa, this one now, is where you find the supraspinatus muscle, right? So this one is a depression above. So that's what they say supra is above, okay? So it houses the supraspinatus muscle. Then for the infraspinatus, this one is a depression below, all right? So it houses what? The infraspinatus muscle, okay? So for the subscapular fossa, also that is a large convex surface on the anterior aspect. It provides attachment for the subscapularis muscle, okay? Then the medial or vertebral border, okay? This one is a lateral border, so the one at the other side is the medial border. It's is the edge that is closest to the spine. It serves as an attachment for several muscles, including rhomboid major and rhomboid minor muscles. Then we have the lateral, also known as the axillary border. Its edge that is closest to the arm is attachment for teres major and teres minor muscles. Okay. So superior border now. Superior border. This is the superior border. Okay. Superior border of the scapula features what? The subscapular, the scapular notch is a passageway for what? Is a scapular notch. It's a passageway for what? Suprascapular nerve. Okay. Inferior angle is the bottom point of the scapula, moves in wide range during arm movements. Alright, then what is the function of the scapula as a whole? We said that for muscle attachment, it provides attachment for many muscles. For joint formation, it actually helps to stabilize, okay, the shoulder, the upper limb, okay. For protection, it shields the back of the rib cage and internal organs that could be found there, okay. So that's it for what? Anatomy of the scapular bone.